game programs incorporate Eastern and Western knowledge to provide information on health, nutrition, exercise, stress reduction, and energy medicine. They are designed to further the understanding of the mind-body connection and the improvement of general health. The information contained in this video is not a recommendation or therapy for any particular illness. For optimal health benefits, please consult your physician.
A controversial new treatment combining the best of Eastern and Western medicines is drawing raves from patients and skepticism from the established medical community.
Dr. Yi-Wing Tong, who is a medical doctor, he was born in China, came over at the age of 14, went to Caltech, and doctor, I am fascinated with what you have done combining acupuncture with Western medicine and doing amazing things with it.
Doctor! Tell us, because this is exciting. This is really great. You're working with all sorts of different types of people that have different kinds of ailments, and they've already been the traditional route, and by traditional I mean anything from chiropractic to orthopedic to surgery medical doctors, drugs, and they've tried all of these things and they're not working, and you've worked with depressives. You've worked with people with physical ailments that are severe. You've worked with sports people with chronic pain. You've worked with arthritis. You've worked with all of these different things. And these people are getting relief in as little as a few sessions.
An amazing blend of ancient philosophy and modern medicine be the final cure for your anxiety? That's up next. Stay with us.
All chronic diseases are curable. I know this is a very astounding statement, but I'm writing a paper, I already published one, and when the body energy and chemistry are balanced, they are cured.
Hi, welcome back. I'm Dr. Bill Berger. We know among the medical community that more people go to alternative care providers, people like acupuncturists and holistic doctors, than people actually go to their primary care doctor, the mainstream doctors. And there may be a reason for it, and we're here talking with someone who can give us a reason for it, Dr. Yi-Wing Tong. He was originally an anesthesiologist and is now involved in neurobioenergetic treatment. Quickly, before we go to our caller, tell us a little bit about how that East meets West types of therapy. We talked about anesthesia and acupuncture. Tell us what you're doing and why it works.
Okay. The weakness in Western treatment is that it only treats the symptoms. The Eastern treatment treats the underlying cause, but it's very weak in suppressing symptoms. So when you combine the two together, anesthetic injections to control the symptoms and acupuncture and herbs to treat the underlying problem, you actually not only relieve the symptom, but you slowly reverse the disease to get a cure. And that's what I do, okay? That apply to chronic pain disorders as well as chronic non-pain disorders such as allergy, asthma, diabetes, high blood pressure, and mental disorders, stress, and so forth.
My guest today is Dr. Yi-Wing Tong, a U.S.-trained anesthesiologist who's developed this new treatment technique. Kenneth Santori and Christine McDonald were patients of Dr. Tong's and are here to share their stories as well. Thank you all very much for joining us this morning. Dr. Tong, I should start with you. It is called neurobioenergetic treatment, or NBE, because I don't want to have to say that again.
I hate that term.
What is it?
Okay, it's a combination of Western anesthetic blocks to control the symptoms, and Chinese medicine consisted of acupuncture and herbal medicine to treat the underlying energy and chemistry imbalance. So the cause of the problem are treated by Chinese medicine, but the symptom are controlled with Western medicine.
Okay.
Yeah.
How does this differ from what we have had in the past available to us?
Okay, Western medicine treats the physical symptoms, but ignores the functional underlying cause of the problem. So without treating the culprit, the problem keep coming back and back. So you go to one specialist after another specialist and go through a whole bunch of tests. And afterwards, you all come up with more drugs, more surgery. And both drugs cover up the symptoms, surgery remove or repair the complication, but the underlying cause is still there. So the patient goes through life going to a different doctor and never ends. And that's why medical costs are so high. If you can cure them, the problem is solved. My treatment cures the problem.
You brought a lot of information with you today contained in these books that are here on the table, and of course I've read considerable information that was sent to me as well. And you say that you can cure, I mean not just treat a number of diseases,
right,
but actually cure them.
Yes.
Things that have eluded us for forever.
Absolutely true, okay? And in fact, that's what my article to the medical journal is going to say. And I'll explain it with this, my scientific background in Western terms. So there's no theories like the gate theories or endorphin effects, which frequently associate with acupuncture. Those are the effects. No, gate theory is just a theory. Endorphin effect is just one of the things that acupuncture produces, okay? But what happens is that I actually restore the circulation abnormalities. So from migraine, arthritis, TMJ, all pain disorders, as well as non-pain disorders like high blood pressure, diabetes, asthma, even mental disorders can be cured.
You can understand why, being in medicine yourself, you can understand why the medical community, I'm sure a lot of our viewers and even probably some of your patients are skeptical, thinking this guy couldn't possibly be real.
That's why I brought the books, okay? These are just part of the results. The red book here, okay, is to categorize all pain disorders, from injuries, arthritis, back surgeries, back pains, those who had surgery, or those who had not had surgery but recommended surgery, carpal tunnel syndrome, TMJ, corsalgia, reflex sympathetic neuropathy, cancer pain. Those are patients that had tried everything, came to me, a few treatments, much, much better because of anesthetic blocks. With acupuncture alone, many times we work takes a long time, but a lot of times it doesn't work. And the blue book consisted, that was just what I've been doing recently. In the beginning, I was skeptical too. I thought acupuncture can, this method can only treat pain, okay? And then later on, the patient came back and say, hey, my blood pressure is better. I don't have to take my diabetic medication anymore because my blood sugar gets lower. Then I start digging into the books, and then the more I do it, then finally, a few years ago, I suddenly understand how it works. Now I treat everything, including mental disorders.
Okay, I'm going to stop you right there because you brought a couple of your patients with you, and we'll talk to them right after this. Stay with us.
Dan got into a car accident and got spinal injury, and he was paralyzed from T4, the waist down, okay? From then on, he suffered a lot of pain. He had two major surgeries. One back surgery put in a steel support in the spine. The second surgery to remove it because it's causing too much trouble. In other words, they designed a very heavy-duty plastic brace for him, which caused a lot of pressure sores and infections, okay? And in addition to the constant excruciating pain, he was suffering recurrent urinary tract infection due to a neurogenic bladder as a result of the spinal cord injury. Been seen many, many specialists in many rehab programs. From 1980 to 1985, he finally got bedridden. From 85 to 87, just vegetating in bed until he came to see us. In about 3 years, we got him back, no more supports, very little pain medication. He's full-time in school now, and he's the chief editor in the newspaper. I mean, it's an incredible story.